Oh, here it goes.
Hello everybody, here we are again, it's Thursday, and here we are, Alex and Naomi with the infant feeding team at the John Radcliffe Hospital. We're in our office today. We've got a lovely view, there's no one else in, so we're not going to be disturbed by anyone, hopefully. How's your week been? It's a bit cooler now, so I'm hoping that you've all got absolutely loads of milk from feeding last week, and babies are happier and you're feeling full. So this session is for anything to do with feeding your baby. So if you're giving formula, that's also part of this forum. And also if you're weaning or trying to relactate or anything that you're worried about, then please do put your questions down there. We love questions and we get absolutely brilliant ones every week. So hopefully that will carry on. Hopefully we're going to start seeing some people watching shortly.
Yeah, I can see them coming up.
Yes, they're coming up now. There's a few of you there. So we're hoping that you've got brilliant questions. We won't be able to answer questions about anything other than infant feeding. We'll try, but it's not the areas we work in. So if you've got midwife questions to ask, then direct them to your midwives or to the Ask the Midwife sessions, which are on alternate Mondays here in this forum, in the OMVP forum. And also if you've got scan and visiting things to ask, then probably the best place is to look at the John Radcliffe website page, and that says on the front as things are changing, and they are changing, they're always changing. And I think visiting has sort of got less strict now, and it's really nice to see partners around on the ward again.
Yeah, we're here for more than an hour now, which is nice.
Really, really helpful. They're feeling so much more part of their baby's life, which is really lovely, and they're helping doing things. We had someone washing up bits yesterday, and you know, helping them cuddle a baby while you go and have a shower, and it's not missing out on chatting because you've got 1 hour to do everything. So it is really nice. It's really, really special, and I think mums are much happier for it.
I think it makes such a difference to have a second pair of ears as well, because when we, you know, whether it's us or one of our wonderful team and the maternity support workers or the midwives talking about feeding, it's so handy to have a partner there who's listening in too. I met a lovely couple on the corridor today. They were having their newborn check, what we call the NIPE, the newborn check. They were waiting on the corridor. And she was feeding a baby outside the door, waiting to go in for her appointment. And I said to her, oh, it's lovely to see you feeding. She said, oh, I've seen you on Facebook Live. And she said the baby hadn't fed much in the first 24 hours because it was day one for her. And I said, that's fine, don't worry about it. And that's really, really normal. But your baby's going to wake up now and going to really, really feed. And tonight might be, you know, a really full-on night with tons and tons of feeding. And I looked at the partner and I went, that is normal. That is normal, because I think that's what sometimes there is, that mismatch between what we think a baby's going to do and what babies actually do, and having that extra pair of ears listening in to hear what is normal and what to expect, so that you don't second guess or doubt yourself on your abilities to feed your baby, which is what I said to her. Just keep going, your baby's meant to do that. So having not fed a huge amount in the first 24 hours, she's now anticipating this baby's now going to start feeding lots and lots and lots, and she's going to be ready for it, which makes all the difference. And he's going to be ready for it too. You know, if a partner's alongside and is ready for that, that's fantastic. And
they've heard it. Yeah. Because I think that they don't believe it if you know, they say there must be something wrong. And I know that, you know, if dads haven't been part of the early days while their partner's been in hospital, then they don't have that sort of build up to it. And they don't get the reassurance. They suddenly just get a baby at home and it's crying, and they feel very anxious that there's not enough milk. And I think that's really important, that you understand that you know, babies do feed a lot, and we talk about this on here a lot, about babies growing horns. Well, I do. Alex never says it.
No, I do.
They grow horns at 8 p.m. and they go away at 8 a.m.
Yeah.
And that's always on your second night.
Yeah.
So you know, they've realised they've been born. They've had a couple of feeds, they suddenly, you know, they're quite sleepy, you're tired, they're tired, and then suddenly, you know, they suddenly realise that they want to have more in their tummies, and they've started to poo, so the meconiums all come out, and they've got space there now as the colostrum is lining the gut, as it's as the meconium poo comes out. The colostrum lines the gut and protects it all, and puts this lovely barrier between you know, the rest of the baby's immune system, and it lines the gut and protects the baby against pathogens which could damage or trigger allergies. So this is where we talk about the colostrum being protective with the IgG and the IgA and all of the antiviral antibody stuff that goes through, and that is then a barrier for the rest of the body to not be triggered to get the allergens and things if babies are exposed to it. So that's why it's so important to get babies with colostrum early, to get through that, and then as the poo all comes out, the baby's tummy starts to be ready to receive more milk, and so after about 36 hours babies start to wake up and want to start to receive more, and the volumes in your breast go up very slightly each time you feed. The volumes go up very slightly, and it's tiny amounts. Remember, we talk about that a lot with tummy sizes. We can do that, can't we?
Yeah, find it in our box.
And in our box of goodies, see if we can find it quickly. Alex likes to hold them up.
It's always my job.
So your baby's
I know
got
my
a tiny
place.
tummy in the first, first 3 or 4 days, and then it gets a little less tiny.
It's a tiny weenie.
And so that's why we talk about small volumes and frequent feeding. So tiny drops of frequent feed. So they should be given lots and lots and lots of colostrum, but tiny amounts all the time. So
So when you say lots, it could be 0.1, it could be 0.2, and that's as it's in the frequency is really important, not the volume so much. And they grow quite quickly. So this is a day 3 tummy. And this is more or less a full-grown tummy, so they really do increase in size really quite rapidly.
People are quite often shocked about the small amounts that we are talking about, because you might think it's half a bucket full, and actually that is 0.1 or 0.2 actually, and nearly 0.2. So that is the volume that we would say is a large amount. That's lots. That's lots and lots, and that's golden syrup on steroids. So it's really good. So as the days go on, you'll hand express more, and by the end of day 2, you should start to see more in the syringe, and it should be like a sort of a clear, thick, gloopy, yellowy, goldy colour. And then as it starts to transition, it becomes more sort of orangey and more volume, and then by day 3 or 4, you should have mature milk, which is then white. But that's, your baby's not ready to receive large volumes for all the reasons we've just said. There's meconium, and they have to get rid of all that. And the more colostrum they get, the more meconium they pass, the less jaundiced they are.
Yeah.
Because as the meconium sits in the baby's tummy, in the bowel, not the tummy, it creates babies to get jaundice. They get higher bilirubin levels because they're not excreting all the byproducts of the breakdown of red blood cells in their liver, which is babies have very high red blood cell count when they are in utero, because they breathe through their blood in the placenta rather than through their lungs, and they have to break all of those red blood cells down in their liver as they're born, because they don't need those high red blood cells anymore. And so they break it all down, and the byproduct is bilirubin, which is yellow, and it's fat loving, so it goes to all the fatty surfaces in the baby's body, which is under the skin, and if it gets really high, it goes up into the brain. So that's why we get worried about babies that are jaundiced. So the more breast milk you give, the more colostrum you give, that gets the process going and gets rid of the meconium. But actually then as the milk comes, it flushes everything out, and the baby is then the products of breast milk then attach to the bilirubin in the baby's gut and excrete it. So that they pass it out. So even giving formula doesn't get rid of jaundice as well as breast milk, because it's the products in the breast milk that attach, they bind to it, and they help to bring it all out, and that helps your baby get over its jaundice. And physiological jaundice is quite normal for that reason, all the reasons I've just said.
I was always taught about 60% of babies will have some form of jaundice, will have a bit of jaundice.
Yeah.
So that's the majority of babies will get it. And we're only concerned when it starts to hit quite high levels, and that's where sometimes mothers will have to come back in with their babies because they are jaundiced. And it's a bit of a vicious and quite a negative cycle, because once a baby's jaundiced, they do become a bit drowsy, they feed less, and actually what they need to be doing, they need to be feeding more. So you end up with a baby that's drowsy, not feeding well, not ingesting that milk, as Naomi said, that will help remove the bilirubin from the gut and stop the baby reabsorbing it. So yes, that's why it's so important to keep feeds going. Even if you've got a drowsy baby, maybe you're using a colostrum and a syringe, and you're giving it into the cheek, and the baby's going to absorb it that way. But it's really important to keep the feeds up, even if your baby's drowsy.
And if you've had a forceps or a Von-Teuse delivery, you'll have a bruise on your baby's head, or a bit of bruising, and that creates even more jaundice. The even more problem is the babies that are under 37 weeks, or even under 38 weeks. Some babies 37 weeks are very sleepy, but they've also got immature livers, and so they don't break down the bilirubin in their liver as effectively as a term baby. So they end up being more jaundiced because of that. So you almost expect a baby that is early to get jaundice because they've got an immature liver and they can't do anything about that. It's just not able to deal with what's being fired at it. So if you've had a premature baby and a Von-Teuse, say, you are going to have a baby that's probably going to be quite jaundiced at the end of the day. And the more breast milk you give, the better it is. The baby becomes less dehydrated and they poo more, and then they get better quickly. So that's why we talk about topping them up if you've been in hospital and had a jaundiced baby and you've been really disappointed because your baby won't go to the breast and feed. It's because they are too sleepy to feed often, and they have to be under the lights for a maximum amount of time to get rid of the jaundice quickly. You haven't got time to breastfeed them and then pump and top up and do all of that, because the concern is that the babies get fluids. They get quite dehydrated under the lights, but they also are dehydrated because they're sleepy as well. So you have to give the maximum amount of food as quickly as you can to get them back under the lights and to get the food into them, because they don't often wake up to feed. They're really sleepy.
They're drowsy.
They're so sleepy, and it progressively gets better. So that's why we talk about that, and that's why it's so important to protect your milk supply and give small amounts and get rid of all of that meconium. How have we got here? It's amazing, isn't it?
We've got some questions. You might want some questions
so
in
that
there.
you get home and you get your milk supply in plentifully, which is what we aim to do.
We got there because we were talking about stomach sizes and then we were talking about tiny mini amounts. But that goes out. The first question we've got through is from Michelle. She said, "Hi ladies, my baby's 15 weeks and I suddenly had a panic that my milk supply is dropping. I've always had a good supply. Baby's growing well and still lots of dirty nappies, but this afternoon I pumped and only managed to get about 200 mils in 20 minutes. I'm not a regular pumper, but I'm sure it's been quicker to get more in the past. My breasts don't regularly feel full anymore, but I do sometimes leak from the other breast during feeds. Should I be worried? No." I think it's the answer to that. If you can pump 200 mils in 20 minutes, no, I don't think you should be worried.
The volume in your breast doesn't go up from 6 weeks to 6 months. So what does happen is your breasts don't feel full anymore, because it becomes endocrine to autocrine, the system. So it then responds to what's being asked of it rather than having to be stimulated. So you don't get that fullness that happens when your baby cries. Say when you have when you first have your baby and you're in the corridor in the supermarket and suddenly you get a letdown, don't you? It's out of control. But that all stops when your baby gets a bit older, and so you start wearing smaller bras sometimes, or your breasts don't feel like they're lactating in the same way. But that is normal. That because when your baby asks for it, the milk is there. And you may not have as good a response to a pump at that age, than you had at early days pumping as well.
But 200 mils, that's more than a normal feed. So we anticipate a feed will be in the region of 80 to 150, regardless of the age of the baby. So once they're at full, 4 weeks plus, a feed may be somewhere between 80 and 150. So you're doing that and more. So, and we've talked about it on here numerous times, that the volume of your milk that you produce does not continue to increase. In fact, it's static from about 4 weeks onwards. And it's only the constituents of the milk that keep changing to meet the baby's needs. So your milk has calibrated itself in volumes wise to your baby's needs. And to be able to pump off 200 mils in 20 minutes, you've done an amazing job. That's fantastic. You've said your baby's gaining weight. You said your baby's got dirty nappies. So we would have no concerns about you at all. It's normal to not feel fullness, and it's normal that your milk supply calibrates to meet your baby's needs. So,
I mean, if your baby starts to ask for feeds more frequently and it doesn't seem to be happy after you've fed, then you would probably have a different conversation.
Yeah.
But if everything is the same, you've got enough.
Yeah, absolutely. You don't need more than that. We only need just enough to feed our babies. So, and should you'd be in the position that you didn't have quite enough. It's just a case of offering more feeds or doing some pumping, and the milk supply will come back again. You've already put that order in, you've already laid those foundations down in the first 2 weeks, and once you've done that, the supply can dwindle, and on occasions for many reasons. And if a mother then wants to increase that, then actually she can do, because in this lactation she's had more milk, so she can ask for it again. So I think it sounds like you're doing a great job, and your baby's also doing a great job, and I don't think you should have any concerns.
But call your health visitor if you're concerned. Just check with her, see if the baby needs weighing if you're worried about anything.
Yeah.
Hope that helps.
Yeah. Do by all means get in touch with somebody if you've got more concerns. But I think that our gut feeling will be you're doing a fabulous job, and it's just your body's behaving very normally. Charlotte's come on, and she's got her doctor's appointment for the second baby tomorrow. And she says Alicia was sleeping through the night. Whoop whoop. She's gone.
Say that quietly.
Yeah, don't tell everybody.
You waited a long time for that.
Yeah, mind you can have another one soon, and then that one won't sleep. So, well done, Charlotte. Jessica has said, hello, my baby's 7 weeks old and I'm feeding her exclusively with breast milk by expressing into a bottle. She was feeding from the breast while I was in hospital, but I stopped when I got home because I was quite unwell. I'm now really keen to get her back on the breast and wondered if this is possible and if you have any tips. I have enough milk. It's just getting her latch right. She can do it sometimes and then other times gets agitated and then struggles after with a bottle. Thanks a lot. Well, yes, I can imagine you do want to get it back to the breast, and well done for keeping your milk supply going for all this time. That's really good. 7 weeks is fantastic.
I think, try when they're sort of the dream feed. So when they're a bit more sleepy, or put her on the breast after a feed so that she suckles for comfort, and then she starts to recognise it as a nice place to be. Have a bath and see if she'll get in the bath with you and suckle on the breast in the bath, because she's nice and relaxed, and just let her play. And just try and get some support. The health visitor service will be there to help you in the community. Also Oxfordshire Breastfeeding Support, La Leche League, baby cafes, they're all great for supporting you with the baby at 7 weeks, to try and talk through anything if you're really struggling to get positioning, or she's got breast refusal or something like that. But I just think you've got to make it fun. So don't try and do it when she's really hungry, because she will get quite cross. The other thing is that they're very flow-driven babies, and the way that they get breast milk is that they have to suckle a few times to get the letdown, and then once the letdown comes they get the volume. Whereas in a bottle they get volume instantly. So sometimes they go to the breast, they don't know what they're supposed to do because there isn't any milk for them to suckle on, and they don't put the two together. So you could get your bottle and just trickle it above your breast when she's on the breast and give her milk. It makes a mess, so you need to put a towel around you and her, but underneath, but you can just dribble milk all over and make a mess around her face and around her mouth, when she's feeding. Usually goes up their nose and all over. But they get positive feedback, and then they start to suck because there's little bits of milk going in, and then they get the milk and then they start to suck. So I always talk about doggy biscuits, but actually it is a doggy biscuit for her. She's literally getting a present. So that's what you need to be doing, so that she recognises that she's got to suck to get the milk a little bit, and then she'll get her feedback, and then she'll start to suckle. But it's all about flow, and so if she's had 7 weeks of bottles where she gets flow, that suddenly stops. She's going to think, well, what on earth do I do with that? And the other thing is that she's had plastic in her mouth for the last 7 weeks. So if you've got lots of milk, it might be worth trying her on a nipple shield first to get the flow and to get her on. If you really can't get to the breastfeeding, you don't need to do this at all, and that's not without problems. But it just means that she transitions to being very close to the breast when you're feeding, with the plastic in her mouth, and then you can take it off when she's suckling and put her back on very quickly, and she will get the flow then and carry on. Or make sure when you are giving bottles that you've been holding her close, doing the responsive bottle feeding, but also you're doing it on both sides, so that you're feeding your baby on both sides, so they get used to feeding on both breasts as well, because that must feel very odd. So if you're feeding your baby, make sure that you're doing what we call the responsive feeding, where I'm sure you are, that you're holding them up but very close to you like that, but also swap the sides around so that you're doing that as well with the bottle feed as well, so that they get every opportunity to recognise that it's the same sort of positioning that they have and that they're close to you at the same time. And
I think the other thing to
help.
mention as well is that always try and get your baby to gate for the bottle. And it's something that we say a lot, is that, you know, actually getting the bottle and brushing down the baby's lips, encouraging them to gate. Because what we often find is if babies had a bottle, you know, been fed by a bottle a lot, that actually what happens is that they don't remember that they need to open their mouth, and in order to breastfeed you need a baby to literally sort of open their mouth and tip their head back. They go "Nuh," and that's what we want them to do. So encouraging your baby to do that for every bottle feed will help your baby transfer to the breast. So it's brushing down the lips, encouraging the gait, watching for that head tipping back, tongue dropping, nice big white mouth, reward them with the bottle. And that way that when they'll know that when they get to the breast, oh, I have to open my mouth because I'm going to be fed. And that just keeps that positive reinforcement going for a nice big gape, because it's not possible to get a baby on well without a nice big gape at the breast.
I think, you know, I have read in different places as well that some people encourage mums to hold the teat, so you're sort of compressing the teat when you're feeding.
Have you got a bottle?
A bit.
Oh yeah.
So you kind of hold this, and this is a newborn teat, but you kind of hold the teat for the first 2 or 3 suckles, and that stops them getting anything. So they have to suck 2 or 3 times at the bottle before they get any flow then, and that sometimes then teaches them to go back onto the breast. They get used to having to wait for food before they get it, and so they suck, and they don't get much, and then you release it and they get some. Now that might really annoy your baby when they've been getting bottles without that, but you know, if you are doing that, it might be worth trying that you actually just stem the flow of milk to start with, so that they learn that they've got to suck 3 or 4 times maybe before they get anything, and that might help with the transition as well. Try it and see.
Jessica, you mentioned that sometimes she gets a bit agitated. I think the final thing to say is always keep the breast a positive place. So when you've got a baby that we're hoping will transition to the breast, if you get her there and she's grumpy and that's not what she wants to do not persist. Stop, feed her with the bottle, try it again later. And we want to always keep the breast something as a positive place to be. So, you know, if she's upset, don't do it. Have a break, try it again later when she's in a better frame of mind to try it. You know, or maybe try the bottle and then try again when she's a little bit calmer. But it's but persisting. And I do remember meeting a mum, and she said to me, "I'm very stubborn." But the problem is actually, you know, she kept trying, and in the end, you might end up with a baby who literally gets to the breast and goes, "This doesn't work for me. Take me away."
Breast strike. What's
and
in it for me?
Yeah, so keeping it a positive place with lots of skin to skin, lots of rewards, like Naomi's been saying, dropping milk, and that will give you the best possibility of it working for you. So anyway, that was quite a long answer for you. I hope it helped. It's given you some suggestions there, Jessica.
Yeah. Good luck.
Michelle's come back and said thanks for the reassurance. She feels much better now. Great, because we think you're doing a great job.
Absolutely. 15 weeks, that's amazing.
Yeah. Charlotte says Alicia's trying to call at last. You won't be in a hurry when you're trying to deal with a newborn, Alicia, and she's all over the place.
Never going to have a cup of coffee now.
Any tips on getting Alicia to eat normal food? As every time I give her finger food, she chucks it on the floor. Oh, she'll get it eventually in her own
is
time.
fun.
Yes.
That continues until they're very much older.
She'll get it, don't worry.
But you know, keep persevering and make it interesting. We always
Yeah.
say rainbow colours, nothing white.
Yeah.
Make it fun, make it look interesting, make it look like a jewel, you know, and they'll pick at it with awe because it's lovely colours.
I love watching when they learn how to do that, don't they? It's a real
motor skill.
development stage when they can actually do that finger pincer to actually pick things up. Jasmine has said, my baby will be 6 months on the 10th of August. Is it okay to start weaning on that date, even though he can't sit up unaided? And what first foods do you suggest? Oh, well, there you go. That was a perfect lead on to it. We're talking about finger foods. I mean, there's 2 really distinct schools of thought, but there's no reason why you can only have to do it one way or the other. I mean, I
think if your baby's not sitting up massively, it may not be ready. Is he watching what you're doing at the tables as well? You know, look at what he's doing. Is he trying to eat off your fork? You know, because some babies watch every mouthful, don't they? And they want to devour you, and other babies just are not interested. So just look at what your baby's doing, and if he's ready, and if he's not quite ready, just leave it a bit longer if he's meeting the milestones. And you know, colourful food.
And 6 months is very much a guide, you know, it's a guide from that point of view. It's not, you have to do it at that date, it's a suggestion that babies are usually ready for it at that stage. And they're usually able to control the food in their mouth, and as you've mentioned, to be able to sit, and that they're ready for it. So you can leave it another week or two, and you might find that your baby's suddenly doing it, you know, doing the sitting and able to do it. But we don't really want a baby that's slumped. They won't be able to eat particularly well in that point. But when
you know, it's having food in the mouth, isn't it, for development of speech and sounds and things like that. That's quite important a bit later. But that's just a guideline, and some babies that are not ready, as Alex said.
So I think that, you know, it doesn't have to be the 10th of August, and congratulations on getting 6 months, by the way. It doesn't have to be the 10th of August, it can be a week or so later, and you might find that suddenly your baby's ready. And there are different, as I said, different schools of thought as to whether you do baby-led weaning or you do more puree type food. And the really good resource for that is the First Steps Nutrition. They have a lot of information about weaning, well, what we call complementary foods, we tend to call them, or introducing solid foods, because obviously your milk comes first. Naomi's already said it today, food before 1 is just for fun, so it isn't a huge part of their diet at this stage. The nutrition your baby gets still comes from breast milk or formula milk up to the first year. That's where their main nutrition comes from. Everything else is an addition, and not the main source of nutrients until they're over 1.
So you'd always breastfeed first or give a bottle first, and then you'd introduce the solids afterwards, and they'd just pick at it and try them. But you know, lots of very soft foods, avocados, bananas, that sort of thing babies like, and sweet potato, vegetables.
I think some good
breast milk with it.
Yeah, some good suggestions on First Steps Nutrition as well.
Yeah.
So,
have fun.
Yeah, absolutely. Enjoy.
Make
So it's a real landmark. You'll find your floors cleaner than it's ever been in all your life, because you're constantly cleaning the floor after meals, I seem to remember.
What if you've got a dog?
Yeah, no, I didn't have a dog. It was me on my hands and knees cleaning the floor.
They'll be in heaven.
Yeah. Chloe has said, hello ladies, I'm new to this page. I'm 35 weeks pregnant tomorrow with my third. I tried to breastfeed my first, but he was born with a cleft lip, so it was very hard and he went onto the bottle. With my second, I bottle fed her, but this time I really want to try and breastfeed. But my last child was 10 years ago, and I feel like this is all new again, and I'm unsure of what help I will get with breastfeeding. Well, that was a perfect question to put in, Chloe, because one of the questions we were going to talk about is where to get help, wasn't it? We decided to talk about
we got
that.
sidetracked, so that's perfect, isn't it?
Yeah. So, well, first and foremost, it's your midwives now in the antenatal period. There's an antenatal conversation in your Blue Notes. If you have a look through your Blue Notes and you've got your lovely pull-out page, carry on, and there's an Every Kicks Counts page, and then there's an antenatal conversations page. Have a read of that page, because it's got stuff on there talking about things that you might want to consider. You know, the reasons that why breastfeeding is important is, you know, the nutrition is obviously extremely important, but that relationship, that bonding that you get with breastfeeding is really, you know, crucial to emotional well-being. I'm not saying you can't get it with bottle feeding, because you definitely can, but it's all the different things that go with it. So have a quick look at that page, and, you know, at your antenatal appointments, talk to your midwife. The Oxfordshire Breastfeeding Support are offering antenatal sessions now as well, so you might want to try and link into some of those, because they would be really good. Hopefully they've got one before you're due, because you're 35 weeks now.
Have a look on our website.
Yeah, we've got
all the leaflets available to you on resources on the John Radcliffe Hospital page. If you just put John Radcliffe Hospital infant feeding or breastfeeding or whatever in, you know, that genre, it'll come, or maternity, the page will come up, and then you can go into infant feeding or breastfeeding. It'll take you to the link, whichever, and look at resources and extra leaflets. I think it's on a side, a little bit on the side that you click on, and then you can see all the different leaflets that we give out, and it has got one on antenatal harvesting, so collecting breast milk before you have your baby.
Yeah.
And then it's got things like Off to the Best Start, which is the leaflet that we give out to everybody. You should get one at your 36-week scan.
Yeah.
And
so
if
next
you don't
week.
get offered one, then ask for one. Ask for a breastfeeding leaflet, and then you can read through that, and that will give you all the information you do actually need to know about early feeding, and you know, how to help yourself get that early feeding. We've also got links on there about how to hand express, and things like relationship building and skin to skin and early feeds and position and attachment and things like that. And also, how do you know if your baby's getting enough milk? So all of those things will help.
Yeah, that's a series of 7 videos that we've done, which are available via a link on our page. So as Naomi mentioned, if you go OUH maternity feeding, it'll come up, and then you go through the link. It's called the maternity playlist, and it will link you into YouTube, and there are 7 videos on there, as Naomi's just mentioned. So, and they cover the whole gambit. They go from skin to skin, i.e. how important it is when your baby's first born, through attaching, how you know your baby's getting enough food, as Naomi's just mentioned, bottle feeding and alternative feeding methods. So it's all, there's a whole lot on there. So a bit of homework there for you to bring you up to speed, and make sure it's in your birth plan. Make sure it says clearly on your birth plan. And the first thing that you want to be doing to really get off to a good start is skin to skin, uninterrupted skin to skin contact when your baby is born. Not whisked away for obs, not whisked away to be weighed, not cuddled by anybody else. That first hour and a bit needs to be with you and only you. And that will get your breastfeeding journey off to the best start ever.
So when you're on the ward, so in the labour room, you'll get help from the people looking after you down there to get your first feed in the first hour, and then you'll be moved up to the ward or to the observation ward, depending on your circumstances, and or home. But if you're going up onto the postnatal ward, then you will get help from the staff on the postnatal ward, and they don't know that your baby's waiting for a feed, because today we've got 42 babies on the ward. It's really busy, really
we only
busy.
got 1 set of twins. We've had lots of sets of twins now, so we've probably
2 or
got
3.
more than that.
Yeah. But they're very, very, very busy. So if they're not going to come and look for you, because they're running around at the moment like mad. And for those of you that have just been in, you know what we're talking about, don't you? But if you ring the bell and say, I want some support to breastfeed, then they will come and help you. But you have to ask for it. They're not going to come and find you, because it's just mad. So make sure that you are very proactive yourself. Make sure that you don't leave your baby for long periods. And so that helps yourself, not getting help, but helps you to get the milk into your baby. And you know how to hand express, you learn before you have your baby. Then that's your emergency care, that's your go-to if your baby's not suckling or very sleepy in the early days. And as your baby wakes up, then you can then start to get your baby to suckle at the breast more frequently and get more practice doing that. And then you will go home. But sometimes you go home without your baby having fed at the breast. They may have had 1 feed at delivery and then not again, because they're just very sleepy and they haven't woken up enough to want to feed. And so giving express colostrum is your go-to. But what you do need to do is know how to get help when you get through your front door, so that you've got somebody to come and support you at home or in your local area. Time your feeds with your visits with the midwife. So if she says come in and have a check in the MLU or in the children's centre or wherever they meet, doctor's surgery, wherever you go meet to have your checkups, time it with a breastfeed so that they can support you to breastfeed at the same time.
And try not to feed them just before you go.
Yeah, because then you just don't get the help when you need it. So try and time it so that that's helpful. But also, if it's in between your visits, call your midwife and say, I'm really struggling, I really need some help. Get your midwife or one of the maternity support workers to come along and support you breastfeeding, so that you can get off to a good start. If you don't ask, they don't know. So make sure you ask for help. It's up to you to be proactive and just say, actually, I need some help, not to turn around and say, well, nobody helped me, because they might not know that you need help if you haven't told them. So, be very proactive and ask for help very directly.
I think about, knowing that whether your baby's getting enough food. As I mentioned, there's a video on. Naomi did a fantastic job of mocking up what babies' nappies.
We had great fun with
good fun.
Cottage
Peanut butter
cheese
and
pumpkin paste.
It's a really, really good video to go and watch on our website. So that will tell you if your baby's getting enough and whether you should be concerned or not concerned. If you've got your Off to the Best Start, page 17 has got it all laid out. and that is the best barometer as to whether your baby's getting enough food. Are they weeing? Are they pooing appropriate to age? So that's a really good indicator.
So this is your care plan. This is what you will take home with you. This is yours to take home, and you have it until you're discharged from the community midwife's care. On this page, page 11.
Yeah, 10 and 11.
10 and 11, it's got coloured stripes on it, as you can see. This is the 4 reliable signs, okay, apart from the weight. This is 3 reliable signs, certainly as your baby's suckling and swallowing, and this bit is for the first 72 hours, and then this is after the first 72 hours, so that tells you about how many wees and poos and how many suckling and all of that is your baby doing. And if you're ticking everything in the green box, then you're away.
Yeah, it's like, yay!
Don't worry. But if you're ticking everything in the orange box, you should be on the telephone.
Or even a few in the yellow box.
You should be on the telephone. Because, you know, if your baby's not doing this on day 3, and you're ticking this on day 3 yourself, you need to be calling someone before your midwife comes on day 5, because your baby will have lost more than 10% if you haven't. It won't have gained weight. Your baby should be pooing every day, and if it stops pooing on day 3 and 4, it's going to have lost more weight than we're happy with. So getting proactive help immediately is really, really important. And this is your guide to help you. You've got it in your sitting room with you at home. Have a look at it. Have a look at the websites. Have a look at the videos. Listen to what's there. Look at Off to a Best Start. And you can then help yourself, and then it will give you the confidence to say, nothing sounds right, let's get some more help.
Mm-hmm.
So your midwife is your go-to, and if you're just having straightforward position and attachment problems, and you know, she's not available to come and help, then the next level of care would be Oxfordshire Breastfeeding Support or Baby Cafe in Abingdon. There's Baby Cafe in Abingdon, or La Leche League can support, and there's lots of telephone support that they can give you. And if they feel there's more problems, then they would suggest you call us. You can call us, but we can't see you very quickly sometimes. We're quite full up, and we're seeing babies with lots of weight loss and you know, not enough milk and things like that. So we do see babies from 7 days to about 6 weeks. But the early days, the first week, your midwives and the local support in your community is the most important care. And then you can come to us once you've had that local support to see if we need to, you know, they will suggest if you need to come for further help. But, you know, on day 1, 2, 3, 4, 5, up to day 10 really, your midwives are the ones that are going to support you and help you feed. That's the normal. Unless your baby has got problems, that's the normal.
Okay.
So I hope that helps, but that's where you get your support. And the numbers are all in your care plan. You know, the MLU numbers, the midwife-led unit numbers, are also on the front of your care plan. And there's one in Wallingford, that's 24 hours a day. There's one in Banbury, that's 24 hours a day. And then there's Wantage and Chipping Norton, and also the Spires on this in the hospital, which some of you may deliver in. But they all can help with breastfeeding support on the telephone as well. And sometimes you can go in and get support in the MLU as well. So you can go in and spend the day with them and do several feeds in a session, so that you can embed what you've learned and get it right. So, you know, that's exactly what they're for, to support you in normal and to get you off to a best start. So use them. Okay,
Chloe, well I hope that's helped. So good luck with it. Let's hope you have a really different experience this time and it all goes well. So,
be confident. You're very confident as you're an experienced mum.
Yes,
you know,
that's
you're
the
not
lovely
going to be
thing.
frightened of your baby.
You're going to be very happy
I know
handling
it's 10 years
the baby.
and things are a little bit different to 10 years ago.
Not hugely.
Feeding's the same.
Not exactly, feeding's the same.
Yeah. It might be a little bit different on the wards.
Holly has said, hi ladies, just a quick one. Finn is now 7 weeks, gaining really well, jumped up a centile. I still have an oversupply, so don't want to encourage more milk production, but would like to catch some of the leakage. Would a hacker stimulate milk production or just catch a letdown? Thank you.
I think it might, if you're not careful, it might overstimulate you a little bit. It's not something we would recommend to put on a lot. You might be able to put it on when you're feeding and catch it from the other side, but I wouldn't encourage you to keep it on for very long. It will stimulate you to produce more milk. It will. Anything that you sort of put pressure on your breast will, it gives it a message to make more. So things like the collecting shells that people used to use ages ago, I think they're called Wilkinet shells, that's the same principle. It's just got the half moon cup and you put it on and collect. And if you keep those on all the time, because you think it's stopping your bra getting wet, it will overproduce milk. It will overproduce milk.
They can result in mastitis because they're quite hard. Those ones are hard, unlike the tacker, so they can block the ducts. So,
but I think that be careful, and I think you've talked about positioning and attachment before. Just make sure that the attachment's really good and that your baby drains a breast really well if you can. And the other thing is to try a bit of block feeding. I think once you get to about 7 weeks, if you look at block feeding, you feed for 2 or 3 sessions on one breast and then 2 or 3 on the other breast, and that sometimes it creates the feedback inhibition of lactation, so it makes your breast very full, which sends messages to the brain to stop producing. So we don't encourage you to do it too early on in your breastfeeding experience if you've got a lot of milk, because it can turn it the other way and you end up with not much milk at all. But until 7 weeks it may help you if you try some block feeding if you haven't already done that. And if you have a look at what block feeding is, I think the La Leche have got a article on it, haven't they? And some of the breastfeeding, Kelly Mom will probably have that. That's quite a good website as well. So have a look at block feeding, and that might help you as well.
Right, so good luck with that, Holly. Let's hope things
It's as
improve.
hard as not enough milk and oversupply. It's a really tough one. And actually, we've had quite a lot of calls about oversupply this week. So whether people have just fed and made lots of milk with the hot weather, that might be the case. But we have had lots and lots of people with lots of milk, and it is very distressing.
Jessica's come back to thank you. That was really helpful, and she appreciated our answer. Rose has said, hello, I'm 36 weeks pregnant and I plan to try and express some colostrum. If afterwards I happen to have surplus colostrum that I can keep in my freezer at home, does this have to be given to the baby at a certain time frame, i.e. before my milk comes in? Or can it be given any time afterwards as an extra to my breast milk? Well, it can, but it's a laxative. So sometimes if you have more, if you have more than you need, first of all, you could think about donating it to the milk bank, depending on how much you've got, because the milk bank is always great for colostrum, so you don't get that much colostrum. Or secondly, you could hang on to it for a time when maybe your baby's got a bit of a bug, if they've got sniffles or something. So if you think about it, what is colostrum? It's your baby's first vaccine. It's chock-a-block full of every single antibody you have produced in all your life. And it will act as such. It will be a fabulous little medicine for your baby, should they not be feeling great. So there's no reason why you can't do that. And obviously you can store it in your freezer for up to 6 months, as you can with mature milk. So those are the options available to you.
It's quite salty, so they'd notice it if you gave it.
It's different.
It tastes very different. Yeah, and mums that are tandem feeding will back that up and say that their babies don't, they notice the difference in taste when you're breastfeeding another baby, or when you get pregnant. The milk goes back to colostrum, and babies often say, oh, it doesn't taste the same. It's not quite what they were expecting, because it is quite salty. So they might notice, but it's packed full of stuff.
Yeah, so those are your options really. So yes, you can give it, but be aware it's a bit of a laxative, so you might see you get a bit more poo. Won't do any harm, it'll just get a bit more poo. Think about whether you'd like to donate it or save it for when your baby's not very well. So it could be any of those options. Let's see what happens. And well done for doing the colostrum harvesting. Charlotte said Alicia's always looking at our food, so we're always offering our food, but she turns her head like she doesn't want it. And Alicia still doesn't want her big girl's bottle. We have her, and she doesn't like fruit juice. Oh, she'll come round, Charlotte, don't worry. She'll get it in the end. So she'll want to be a big girl soon. Rachel has sent a message. We know Rachel. We supported her over the last little while. 11 weeks apparently her baby is.
Never.
Yes, how
Well done
amazing.
you.
Congratulations, Rachel. I didn't realise it was that long. Her daughter's 11 weeks old now. Well done. Diagnosed with insufficient glandular tissue after my milk supply issues, so I'm now combi feeding formula and express breast milk. Good volume, well done. The baby's doing really well with weight gain and have been feeding well. However, in the last few days she's been really fussy on the bottle, pushing it away at times and crying lots. She'll take it eventually, and she's still eating the same kind of amount as normal, but I think I may be misinterpreting feeding cues. I've noticed sometimes she'll appear to queue for food, then refuse the bottle, then sleep for 20 minutes, and then she'll feed much better. Is there anything else I should do other than trying to just settle her if she doesn't take the bottle initially. It happens with both breast milk and formula.
You could just take her for a walk for a bit and just see if, just break the cycle and do something different, and that might be all she needs. As you've already said, she might just be asleep, and it might be that she's associating suckling with sleeping for comfort, and you know, that might be the case, so that she's you know, not ready to feed just at that time.
Yeah. And obviously you're doing an amazing job. You're still managing to give her a good volume of your milk, which is fantastic.
Is she teething? Has she got a bit of earache? Has she had a cold? Sometimes just anything like that could be the reason why they're not so happy to feed, if she's just going through a phase. They have quite a big developmental phase between 11 and 12 weeks, and they do get quite sort of fussy with their feeding at that time, and they can step up their feeding at night and want more food at night around about that time, so they're much more wakeful and unsettled generally at that age. So it might be just linked to that, with other things going on as well, but I would just keep going, keep normal, reassure her that everything's okay, break the cycle of don't try and push her to have it, just do something different and then go back to it, as you've already worked out. She has a little sleep and then comes back to it. It's probably something that she'll stop doing. Hopefully she'll be fine, but you know, talk to your health visitor about it if it carries on, and she can perhaps come and talk to you a bit more. Well done you though, that's so lovely to hear from you.
It's lovely to hear from you.
So lovely to hear from you.
Yeah, I really can't believe it's 11 weeks that your daughter is now. Incredible.
Yeah.
Well, congratulations to you. Emma, Holly's come back and said, that's helpful, thank you. Oh, she's given us a name there, Teal Ashton. I don't know what she's telling us that. I don't know. I've missed the significance of that, Holly. So, Becky said, I'm 33 weeks with my second baby and I had a terrible time with feeding and support for my first baby out of area. 2 times 100% tongue ties. It's filling me with anxiety even listening to this. I look forward to meeting you and the support going forward from the JR and community with a healthy baby. I plan to express in a few weeks' time again. Is there anything else you recommend I can do to try to be less anxious about the feeding journey? Becky, I wonder whether you would benefit from one of our antenatal calls. It might be worth it if you had such a terrifically difficult time last time. We do, if you want to have a chat with you can phone us directly if you want, and we'll put you on the list. We normally speak to you about 34, 35 weeks, and so imminently, and we would talk through what happened last time and get a plan put in place, make sure it's on your record, and try and do the best that we can to make sure you don't get the same experience again. And we would make sure it's all on your I'm pointing over there because our computer's over there, all on your computer record so that it's obvious, and we'd make sure there's something written in your blue notes on your postnatal care plan, postnatal pages to say, this woman is under the care of the infant feeding team, get in contact with us ASAP once the baby's born. So I think, if you've had such a difficult time, it would be well worth having a chat with us, talk through what happened, let's see if we can make sure it doesn't happen again and get a plan in place to get support in as early as possible. So Becky, can I suggest you get in touch with us? Email or call. Our number is Oxford 572 950. So that's 01865 572 950. And the email address you can find on our webpage along with the telephone number. So if you go do a Google search, OUH infant feeding, or OUH maternity infant feeding, all our details come up. But I think it might be worth having a chat with you, Becky.
Anything to reduce your anxiety would be great.
Charlotte's come back, so she's so nervous for this new baby all over again, and I'm going to keep watching this chat to learn a lot more to become a better mum. You're a fabulous mum, Charlotte.
Just think what you've learnt already.
Wow.
You're just so experienced when you come to actually having your next baby. It'll just be so natural. You'll feel very confident.
Total expert. It'll be wonderful. Rachel's come back saying thank you, that's helpful, and thanks again for your support, and to Eliza in those early weeks. We'll relay that to Eliza. She's in tomorrow. She's not in today. Becky says she's been referred by Heidi already. I think I spoke to Heidi about you yesterday. So I will make sure we've got you on the list. She said thank you so much. It's a huge relief to hear. Speak soon. Yeah, we will speak to you.
So Emma may arrange an email you and arrange an appointment with you, or maternity support worker who works with us. She may well contact you in the next few days.
Yeah, to come up with a suggested day that works for you. So, right, well that's it at the moment. So, and it's lovely actually because we've known quite a few of them. It's been really nice. Obviously, Charlotte chats to us always. Jessica's been on before, and Holly Emma I met on the wards, which was lovely. And we've obviously got Rachel as well that we know. So lovely bunch. We look forward to speaking to you, Becky. We've got any more questions at the moment. Don't think there's going to be a flurry. So.
Well, we've had a very, very busy week on the wards. It's very, very, very busy. We've, as we said, those of you that have been here in the last few weeks, you'll have noticed how busy it is and how many turnaround in the beds there is. You've got someone new almost all the time coming in and out of the wards because we've got it. So all these COVID babies are coming in, and
it's a real baby boom.
There is a real baby boom.
Yeah.
I think there's a lot of babies due, almost 1,000 babies due this month in the hospital. So that's quite a high number of babies in Oxfordshire in a month. It's a lot.
It's quite funny because it's usually September, which is linked to Christmas. So we're used to September being really manically busy, but actually it is really busy.
It doesn't normally carry on with the sort of the holiday season and everything, so it is full on.
Yeah.
And so please do get help. Please ask for help. Please make sure that your babies are fed, and get support if they're not. Please learn how to hand express if you can. Have a practice before you have your babies if you're watching and you're pregnant, because that will put you on your in a better state when you come onto the ward, that you know how to get milk out of your breast or colostrum out of your breast when you come up from the postnatal ward, so that you actually get on and give your baby food, because you have no idea the impact of that early stimulation has on your milk production. As much skin to skin as you can do. If you have a cesarean, we're still having babies coming back in and having lots and lots of phone calls from staff saying mums are not producing enough milk because they had cesareans, and it's the lack of skin to skin in the very first hour that makes a significant change to your milk production. And it's not often because we can't do it, it's often because you don't feel well enough to have it done. You feel shaky, you feel sick, you feel faint, your epidural comes right up here so you can't move. It's a very strange feeling numb like that. You feel that you might drop your baby, it might be a bit cold, and there's lots and lots of reasons why it doesn't happen, and it's not always because people don't allow it to happen, it's nearly always because of the circumstances that you're in.
But it's remembering that actually you can make up for that by
frequent,
and I mean lots, of skin to skin and hand expressing in those early days. So even if you do end up having your baby bisection, whether elective or emergency, try and get your baby skin to skin as quickly after the birth as possible, and try and get on with lots and lots and lots of hand expressing. As anybody who's met me, I spend my whole time saying you've got to tell the breast this baby has arrived, but you do that by having them skin to skin and lots of hand expressing, and that's how the breasts know, and the hormones then respond appropriately. So you can make up for it. We have lots of mothers out there who have sections, whether that's an elective section or an emergency section, and they do brilliantly as well. But it is down to being proactive and being.
And it's really hard to catch up. It's you can do it, but it takes a lot more effort to catch up if you miss out on that.
Yeah.
And don't panic if you do miss out in the first hour. Just do it as soon as you can, after that time. And then just keep doing it. So if your baby, we say 3 feeds in the first 24 hours is perfectly acceptable if your baby's healthy, normal and term.
Mm-hmm.
If you've got a premature baby or a small baby, then you'll need to feed it every, no more than 3 hours between feeds. But if it's a normal, healthy term baby and it's, good weight and all of those things, you've not had any diabetes or anything in your pregnancy, then, 3 feeds is not unacceptable. Most babies will take more. But if they're sleepy, which they often are if you've had a long labour and had something like an epidural, or you've had an injection in labour to help you relax, that does sometimes have an impact on your baby's ability to wake up and feed frequently in the early days of when they've been born. So you've got to do that. So we say 3 feeds in 24 hours, but you've got to do 8 stimulations in 24 hours, because that will just prime your breasts to be absolutely brilliant on day 3 and 4 when your baby needs it, and they do need it. They will tell you they need it, and if they really haven't got anything at all, they won't tell you anything. They'll be very, very sleepy and not wake up, and probably jaundiced.
And going back to the fact, the fact we've been talking about expressing whilst you're pregnant prior to having the baby, whilst that is absolutely fabulous, it does not mean that you can rest on your laurels in your first, once the baby's arrived. So you might be feeling a bit grim, and many mothers do. They're feeling washed out. If they've had a section, they're probably feeling very uncomfortable. But having that colostrum that you've expressed before is a bonus. It does not mean you should not be expressing. We actively need you to be expressing. That milk can be given if you're struggling to get much off, but actually we really, really need that stimulation straight away, because that's how we tell the breasts that the baby is here. And if you don't give it, the breasts don't know to make the milk. They're not getting that stimulation that they need. So expressing whilst you're pregnant is fantastic, but it should never ever replace the expressing that you do as soon as your baby's arrived, if your baby is struggling to attach or if your baby is sleepy. It must be done. You don't just give your colostrum and leave it at that. If you're giving your colostrum, express at the same time.
You can sleep in 2 weeks' time.
I know, that sounds really harsh, but
we know how hard it is. We know how hard it is. This is our world. But you have to do it, because you've got a very time critical window, and if you miss that window, nothing you do will make the milk. And many women listening to this will know what we're talking about, because they've been there. And we don't know why some mums don't produce milk, because some produce more than others, and we don't know the answers to all of those things. And sometimes mothers do lots and lots of stimulation and they still don't produce masses, and others don't do much and they get masses too. But the norm is that we expect you to stimulate and to make enough, and that's really important, that you hear that and that you understand that it's time critical, and that you can't get that time back. You can't get that first hour back for skin to skin, and that's the one that really whacks up your milk production. And we know that because if you fed in the first hour, the side that you fed on in the first hour, and we say this a lot, has got more milk in than the side that you fed in the next time. That first hour has a massive surge of hormones, and the skin to skin starts it with the feeding. So if your baby's fed on one side, you could do hand expressing on the other, and in that first hour, if you want to, and all you want to do is go to sleep, curl up and have a shower and go to sleep, but actually you haven't got that luxury. You've got to do that.
Do the hand expressing, then have your shower,
and then
go to sleep.
And then wake up and do more hand expressing. We can't say it enough. We just can't say it enough, because it's so important.
It's so heartbreaking when mums don't have enough milk. It really is hard. Really hard.
And they will all be shouting at the screen saying, just do it, because you have to. It's there's no magic way of making milk.
And this links with what I was saying earlier about partners being aware. So, when you're talking about feeding and everything, if your partners aren't listening to this and you're one of these ladies who's messaging in and you're expecting your baby imminently, explaining to them about the importance of early expressing is important as well, because partners, your partner loves you, you're the person they've chosen to be with, you're having a baby together, and what they don't want is to see you having a tough time, and they don't want to make it worse. They want to, very often partners will want to make things better, but actually it's understanding the importance of that and why it's important, because they might, for the sake, because they love you, say it's all right, don't need to do it, or why do you think you need to do it, and making sure that they understand that actually this is a really key mechanism on milk production, is that early stimulation to really get that milk going. Will help tremendously. They can do the nappies, they can do the cuddles, they can support you and encourage you and cheer from the sidelines while you do your hand expressing, and it's irreplaceable, that time that you're doing. We're getting really close to time actually, and Charlotte's popped a few more messages out. She just says she's got low confidence, but that's fine, Charlotte, you're doing brilliantly, and she can't wait to meet her new baby when it comes along. And this time she's hoping for a water birth, but she's not sure that she'd be allowed it after a Von 2s. I don't know that would preclude you. You had a vaginal birth, your baby was born vaginally, and as long as that's happened, best thing is to have a chat with your midwives. And see what they say, but that isn't normally a reason that you couldn't have a water birth. There might be other reasons. Becky's just come on and put another question. Sorry, I keep hitting buttons unintentionally. It's not. We haven't noticed it. Don't worry. Unless you've sent us an angry face. Hopefully not. Is milk production individual to each pregnancy baby? Absolutely. Yes.
So if you didn't make much the first time, doesn't mean you're not going to make much
Yeah.
the next time. It might have been the circumstances. You might not have had skin to
Yeah.
skin. You might not have done early stimulation. You know, all of those things.
Yeah.
And if you've made milk before, the body remembers as well.
Yeah.
So you often get milk a little bit earlier with your second
And a little
pregnancy.
bit more. Yeah.
Yeah.
So,
So fingers
yeah.
crossed it's all fine this time.
We
if
always
that's what
say
you're asking.
each lactation's independent, so you can have, you can make a really big difference from one lactation to another. So, and we often meet mums who really struggle first time round and do absolutely amazingly second time
Yeah.
round because they know what they're aiming to do. So, well, I think we're going to call it a day. We've done our hour, and next week Naomi's on leave, so it will be me on my own. So think about your questions, keep me busy. I hate having to just talk on my own. It's much easier when there's two of us. So I look forward to seeing you. With Becky, we look forward to chatting with you in the next week. Probably be next week. And to all of you who've sent questions, thank you very much.
Yeah, we love your questions, so keep going.
Yeah, and tell your friends
tell
about
your friends
it.
to watch it. Yeah, we'll get more questions then, won't we? If we get more
Yeah.
people watching.
And the more that you know before you've had
Yeah.
your baby, the more likely it is to go well for you. So it really is worth it. And accessing our videos, accessing our online resources would all help.
Yeah.
So
It's all there.
yeah.
You know, to say that if you don't get information, but everything is there for you. You've
Yeah.
just got to push a few buttons to have a little look. But it's all there. And
Brilliant.
it's all very interesting. So go and enjoy reading.
Yeah.
And
Okay.
we'll see you soon.
See you next week. Bye.
Bye.